Hi, it's Bruce, and this is my surgery blog. Okay, for all you older guys over 50, I'm just going to get to it. In my early 50s, I had some pee problems. It was getting hard to pee, a little pressure. And I went to a urologist, and they put me on some medication. It's the prostate swells up in the middle, and it makes the urinary tract, which goes through the prostate, difficult to discharge, and so you put a lot of strain on yourself trying to urinate. So I was on a medication called Flomax, and then I changed to Cardura, which is a heart medicine, but it has side effects of lessening prostate pressure. So I was on that for about 5 years, actually. And they were recommending some surgery, and I wasn't cottoning to the fact of having surgery down there because there's a lot of sensitive issues. So last month I had some, we may have some medical changes with my insurance through work, and my doctor's only on this one plan. So I didn't want to lose my urologist, so I sort of forced myself to accept the fact that maybe I should have this operation, which would be covered. So I went in. It's called a green light procedure, and it's a laser procedure. The week before a few weeks before you have to take a lot of tests to make sure you can have surgery, and the week before I had to have a test where they fill up your bladder and check the pressure of your bladder emitting, which is a very difficult test with catheters. And your bladder flow, your bladder pressure is supposed to be about 20. That's normal. 50 is a little difficult. The worst the doctor's ever seen is 144 of this bladder thing. And my score came in at 200. So they realized that I really needed this surgery. I had a couple problems with the prostate. Besides it being full, I think it was growing a little bit over. It wasn't an enlarged prostate, but they had to go in with the laser and take some of it off or something. So I was very nervous. I had to go under anesthesia, and I came out of it, and I got home, and I need a few days of recuperation. But I wanted to tell you, if you have a BPH problem and they recommend this surgery, have it. The pressure I was putting on myself, I had no concept. They said that I was like almost blowing my bladder out with the pressure that I would have to sustain to urinate. And 2 days after the surgery, I'll tell you, I feel no pressure. It's like I'm just amazed. I'm still in a little pain, and I'm on some antibiotics for after the surgery. But this green light procedure took, I guess it takes about an hour. You have to prep for an hour, and I think I was under anesthesia for about an hour. I have no recollection. I didn't even see the doctor. I saw the doctor while I was in the prep, but I didn't see the doctor enter, and I have no concept what they did to me, where they put what, and what happened. I woke up, and Bill said I was sort of babbling for a few hours under the anesthesia coming out of it. So I highly recommend this green light procedure if you're in this category, but there's different surgeries for these problems, and this surgery was for me, and it was the least invasive, and you can be back and on your feet in 3 or 4 days, tops. I think I'll be going back to work by Wednesday. So I'm a new man. I have like no pressure, and I can't tell you how happy I am. I should have had this surgery years ago. All right. I helped anyone with the BPH urine flow problem. Thanks.